Some things to keep in mind when treating children is generally most comprehensive therapy, you're not treating the child in isolation. You often have to involve multiple environments. For example, the family unit is often involved in the treatment, so parents may come into sessions with the child or without the child to help learn to make a more healthy and effective home system. In addition, when working with a child, you may also need to involve some of their other important environments. For example, the school. Children often exhibit difficulties in school, and there may need to be some changes in their curriculum. Teachers and other educators may need to be educated about how to work with this child. Also, when dealing with children, issues of confidentiality become a little more sensitive. When children engage in behavior where there's a risk to themselves, psychologists are obligated, especially if it's a high-risk behavior, to inform the child's caregiver. In addition, when working with children, some of the children that are referred to therapy come from homes that are highly disruptive. When that disruption involves some sort of abuse or neglect, it's the legal and ethical obligation of the therapist or any healthcare provider to report this abuse or neglect to the proper government agencies. It's important for parents to be involved in children's therapy because children spend a lot of their time in the home environment, and parents are major players in children's life. So just as parents can support unhealthy functioning in children, they also can be taught to support more positive and more healthy functioning in children. The difference between working with just a child versus working with a child and the family unit is that generally when you involve the family, the therapy can become more complicated, but it also becomes more comprehensive. When you work with a child and help teach them positive skills and positive ways to interact with their environment, and the environment, for example, their parents, are not reciprocating in a positive way, often your efforts really go unrewarded, and children are less likely to make positive behavioral changes if, in fact, their support unit, which is comprised partially of their family, is not in on the treatment, that is not actively engaging in this child making some positive steps.